There are many layouts with many fields that you need to fill in order to achieve your goal of totally understanding your refractive surgery practice. Patient information, referral source information, eye history, contrast sensitivity, wavefront data, visual acuity data entered as Snellman or decimal and recorded as logmar, corneal topography by keratometry, by pentacam, and you can use the aura and diagnose whether OCT was performed. Topography can be imported. Refractions can be cycloplegic at the spectacle plane. Aberrometry refraction can also be added, and intermediate near vision is recorded. Pupil size and retina status, lens thickness, and other parameters are then used. The refractive surgery excimer laser layout allows you to perform monofocal LASIK or multifocal LASIK. You can pick which microkeratome you're going to use for your procedure, or if you use a femto laser to create a laser flap, you use this here. Presbyopia surgery by using inlays or presbyopic femtosecond surgery is entered here. If you perform corneal transplants, you diagnose the procedure and put all the information present, and if you use a laser other than a trephine, that information is here. Your surgery plan lists what you are planning to do, and then you could test whether the corneal power will be flatter than 36 diopters and your residual thickness will be greater than 300 microns. Depending on the excimer laser you use, you can then test your surgical plan against a previous regression analysis performed by other surgeons on that laser. Your flap data is recorded on this page, and you can compare ultrasound OCT and Scheimpflug if you choose. With your surgery plan, you can then perform a regression analysis based on your previous experience. Intraocular lens surgery is performed on this layout. The IOL calculations here and all measurement aspects are placed here. Surface laser surgery is performed on this layout. If you perform mechanical intacs, the information would go here. If you use a femtosecond laser to perform your intacs, this is your layout. Conductive keratoplasty, collagen cross-linking, and relaxing limbal incisions are entered here. All complications from surgery are listed here. First post-operative day information is listed on these layouts. A summary of your post-operative visits is listed by diagnosis and procedure, the month's follow-up, and the date that the patient was last seen. And if you look at individual dates, you will then have a visual acuity layout, a contrast sensitivity layout, keratometry layout, topography layout, wavefront layout, refraction layout, and complications layout. Finally, you will be able to have 4 enhancements, 2 AK enhancements or RLI enhancements, and 2 surface or LASIK enhancements. Once you have entered data, you will want to analyze that data, find a group of eyes to analyze, and then perform a report analysis. The 2 major finds that you will use are the automatic find and the custom find. Once you have a data set, then what you can do is go to your reports menu and analyze that data set. If you're looking for group analyses, you have 17 different ways to analyze the group data, and if you're looking for individual patient analyses, you have many numerous ways as well. Once you have a found set of eyes, you might want to look at them by looking at different chart analyses. In the visual outcomes, you can look at lines gained, uncorrected visual acuity and a cumulative basis, and preoperative best vision versus postoperative UCVA. You can look at refractive outcomes by scatter graphs, by distribution, and by induced astigmatism or spherical equivalent over time. You can analyze wavefront data as groups or as individuals, and you can analyze high-order RMS and coma versus UCVA. Contrast sensitivity can be analyzed. Through your marketing tab, you can determine how patients were referred to you, distribution of gender versus age, time it takes for them to convert to surgery, and your follow-up period versus time with each of those individual patients. Using the options menu, you can send referral letters, type operative notes, or write summary letters to a referral source. If your database exists in Excel or Access, you can import it directly into this program. If you have a found set, you can export the data depending on the diagnosis. For instance, all AK RLIs will then be exported to Excel for your future analysis. You can eliminate duplicate eyes. You can print blank forms to go into the operating room or to the clinic with you. You can update from one version previous to this one to another automatically. You can synchronize one version to another. You can make a backup copy automatically. You can send a referral summary to an individual doctor, isolating all cases that that person had referred to you. One of the most exciting aspects of this program is for you to perform a patient projection when a new patient comes to you and asks what their chances are of achieving a certain level of vision. You enter their age and refraction, press this button, and then the program looks into your database for matching eyes and then sends the patient an email telling them what their expected results might be. There are many other exciting aspects to this program. You can look at the help movies on the website, and you can download a demonstration version of the program and enter up to 49 eyes to determine whether this is a program that will benefit you.